in the interest of saving everyone's time. So I'm Jamie. I'm with the County Homeless Program. We actually have a new title, so it's super long. So I'm the Planning and Policy Manager of the Health, Housing, and Homeless Services Division of Contra Costa Health Services, which is a long way to say we're in the homeless program. And I want to talk sort of broadly, but I'm also going to give you a bunch of detail. We'll go kind of fast through that part. You'll get all the information later in written form. But I just want to paint the big picture about how homeless services are changing in terms of how people are accessing all of the services that we have, and some big changes that are happening, which are actually really exciting. So I've been with the county almost 2 years. So if there may be some questions you ask me I don't know the answer to, I will work on getting those for you. I've learned that homelessness is vastly more complicated than any other field I've ever worked in, as you would probably experience doing your work on the ground. Right? There's a million threads, there's a million upstream causes for why people end up homeless. So we'll see how we go. You all are literally the very first people that are seeing this data. So this is our point in time count data, which is every year HUD, so the federal government that funds most homeless services and programs in communities, they require it every other year, and we do it every year. It's called a point in time count. So that is literally, we go out on one single night. They say at the last week in January, you pick whatever night you want. You go out and you try and get a snapshot of what you can tell in your community around who's homeless. So it's vastly undercounting. So we combine this with some of our service data to sort of get the real picture, but this is the point in time count data. A lot of folks are interested in this. So this year, and so we had folks volunteer stationed at Loaves and Fishes. We did an inventory of all of our shelter, who was in shelter that night, at various service sites, trying to do surveys with people, but also capturing whatever we can from inside our system.
Did you ask them their names so that you could?
Yes. So we asked them, folks have really different tolerances for how much information they want to give you, but we actually have something called HMIS, which is our Homeless Management Information System. That's like the big database that a bunch of providers contribute to. So we took what we could get on surveys and tried to link people up so that we could kind of corroborate what's going on. So big picture, we counted 917 unsheltered folks. We know that's probably higher. What I can tell you is the trend actually though is that it's decreasing every year. 214 chronically homeless, and that's a very technical term. Chronically homeless is like a very specific term to HUD. It essentially means somebody has been homeless for X period of time and they're disabled. So they have a verified disability and they've been homeless. It's either for a solid year or total for a year over 3 years. But these are the folks that tend to be the most vulnerable. 695 were sheltered. That doesn't look right. Okay, I'll double check that. 99 veterans, and this actually we've done some very intensive work around veterans and chronically homeless in the last couple of years, and so this number is significantly lower. We've been doing a concerted effort to house veterans. 84 households with children, and only 110 at risk. Again, we know that is vastly undercounting. Our experience, at least my experience being at Loaves and Fishes, a lot of folks who were likely at risk just didn't really want to talk to us. They just wanted to get their food and not engage. We have seen in the last year a 27% decrease in veterans. So now for veterans and chronically homeless, we have what is called a by name list. We actually know by name everyone who's either a veteran or chronically homeless who has touched our system, so that we're able to actually track them and really focus on getting them housed. And so you can see how the numbers are actually going down, which is good, but there is still significant need in our community. So I just do this to paint the big picture. Do folks have any questions about this?
For special funding for veterans?
Yes, that's a good question. So there is special funding for housing. So there's a program called SSVF, which is Supportive Service for Veteran Families, and that's sort of short-term housing and like rental assistance and services, and then something called VASH, which is VA supportive housing, I think, just housing plus services, but long term, for folks that are disabled, and that could be physical or mental health.
It seemed to me that the last point in time count I heard was something around 3,000 total, so this seems
Yes,
better than
well, so last year, the way we did it was a little different. So last year, it was about 1,700 that were unsheltered and about 1,700 that were considered at risk. And the way that we were capturing information about the at-risk is different. So I need to ask some questions, actually. This is the first time I've presented on it and really looking at it. So I need to check in about the at-risk because we know that there are lots and lots of folks that are very precariously housed, particularly as rents keep going up. One thing I can tell you, in the last 5 years, we've seen a 90% increase in homelessness among, or people accessing homeless services that are age 62 and older. So for seniors, this is a big deal because they're on fixed incomes often, and their rent goes up by $300. There's just no wiggle room. So I want to jump into, so Juliana is the coordinated entry system manager. So the way I kind of describe it is she's like from the ground to 15,000 feet. She's working with the providers, really trying to get this coordinated entry system that I'm going to describe up and running. And I'm kind of like 15 to 30,000. So, I'm going to paint the big picture, but if you have specific questions around the system, Juliana is going to be a good resource for you going forward. So I want to just talk about some big buckets of services because I know one of the questions is sort of like, where does White Pony fit in this whole big thing? So I'm going to just sort of walk you through, as somebody hits our system, the kind of stages that they might go through and the kind of resources that they might connect with. So somebody who's at risk, and we're actually working a lot behind the scenes to develop tools to identify these folks and connect them to what's available, which is not very much. So prevention is really trying to keep people in their homes, right? So they're about to become they're not homeless yet, but it's not looking good. Maybe they got an eviction notice, they're fighting with their landlord, they're, living with their sister and their sister's gonna kick them out. So there's some work that can happen to help keep them in their housing. If that doesn't work or they're already homeless, then diversion is really designed to keep people out of the shelter system. So really working with folks, is there any place else that you can stay? Do you have family in Tulsa, Oklahoma? How can we get you to another safe place so that you don't hit our system? Because we do not have enough shelter beds. We have, on any given night, we have about 1,000 people that need shelter and about 500 shelter beds.
So do you have funding to get them?
Oh, that's such a good question. So this is the part of our system that I think is the weakest. So we are really lacking flexible money that can help people either get diverted, right? So like maybe your sister is kicking you out because there's not enough food and your food's, you're not on food stamps. So, or you need some extra, like if you had a $50 stipend a month that would help with food, then your sister might let you stay there. So trying to figure out those kinds of things, there's not a lot of resource that's available for that. And a lot of it is very, very restricted about sort of what your situation is. So, if it looks like it's not just a month or two that you need help, but you sort of permanently you're not going to be able to afford your rent, the prevention programs probably aren't actually going to help you because they're going to say this is just going to prolong this for 2 months. Like this is not actually, we're kind of throwing money in a hole. Let's figure out what else we can do. So, and I'll talk more at the end actually. I'll talk briefly. There's something called the Housing Security Fund. Has anybody heard of this? Okay, good. Yay, one person. So I'll talk more about it at the end, but this is actually a fund we're developing in the county for folks that are already homeless, but flexible money to help them get over the low-level speed bumps that may keep people out of housing. So credit checks, rental applications, maybe extra security deposit. So I'll talk about that in a minute, but this kind of falls in this realm. I don't know what I did. Hold on. Okay. So once somebody becomes homeless, there's sort of crisis services, right? So we have outreach teams that actually go out into encampments, under bridges, looking for folks that are pretty disconnected, that maybe aren't going to come in to get services but really need to get connected. And so these are some of the things they do. And then care centers, which are brick and mortar centers that folks can actually walk into and get basic needs like food and showers, but also there's staffing there to help them start to get connected in, identify what kinds of things that they need, provide some case management. We actually will have some housing support getting folks into housing through these centers, so I can talk about that a little bit more. and then a warming center, which I'll talk about in a minute. So in terms of crisis housing, there are shelters there are single adult shelters, families, and then medical respite. So the Philip Dorn Respite Center, which is next to the Concord shelter, is actually for folks that are medically fragile. The way they get in is they have to be referred, like basically coming out of a hospital, and go here until they're stable enough to move on to wherever they're going to go. Transitional housing, we don't have very much of this in our community, and it's really restricted to pretty specific populations. So HUD, a couple years ago, recognized that actually permanent housing is the solution to homelessness. And that transitional housing, unless you're getting some pretty intensive, specific resource, it's actually best to just get people into permanent housing and bring services in there, and all the issues that you're trying to address are more likely to be stabilized once you're already in housing and you're not facing another move. So we don't have a whole lot of this in our community.
Can you give some examples?
Sure. So Ultima House is transitional housing. We have some transitional housing for, I think Appian House is our transition age youth housing. So for folks that are like 18 to 24, they might need some support sort of learning how to live on their own, how to pay rent. So they'll get some services in there before they would move on to permanent housing. Yeah. So then once we start talking about permanent housing, there's kind of two buckets. So there's rapid rehousing, and this is really short time limited rental assistance and services. So it's basically like if we think you just need a little boost for a little while and you can then be on your own, these folks would get rapid rehousing. If somebody has pretty significant needs, they maybe have a disability, maybe have sort of chronic drug and alcohol issues, and they're going to need rental assistance plus support services for a pretty long time, that's where you get into permanent supportive housing. So there's a couple different providers that do that. Some of these are actually like a whole building that's run by an agency, and everybody in there is in, getting services and has their rent paid for. There are other programs where folks can just be in scattered units, but they have a caseworker that works with them pretty closely, and their rent is paid for. And that's a partnership. So Shelter Plus Care, I'm going to just throw out these terms, so you may have heard of some of these. So Shelter Plus Care is permanent supportive housing, and that's a partnership between the county and the housing authority. So we provide the services, and the housing authority does the rental part. So just to connect the dots, because I know there's so many pieces. Yes, so I'm going to talk a little bit about coordinated entry. So I kind of gave you the buckets of what things people might get. How do they get them? So this is what our system has looked like until recently. So somebody needs help, and there's this like hot mess of providers that are all doing great work, but we were talking about earlier, they're maybe not very coordinated, right? Everybody's like got their mission, and they're chugging along, and they're helping people, but it's not super coordinated.
Oh, there we are.
Yes, there you are, right? So they may not be coordinated with each other, but also how people get connected has been a nightmare. Everybody has their like 13-page resource list, and everybody's just calling down the list. I mean, it's a mess. It's a mess for consumers. It's a mess for providers. It doesn't work for anybody. Contra Costa is not unique in this, and HUD recognized that this is sort of a systemic issue. So they have mandated that all communities, so has anybody heard of a COC, or continuum of care? So that's like the umbrella term that HUD says a continuum of care is this like bucket, right? So for Contra Costa, it's actually the county. For more rural areas, it may be like 2 or 3 counties constitutes a continuum of care, but it's sort of like the bucket into which HUD brings money and also has some regulations. So our HMIS, that homeless management information system, that's a mandate from HUD, and they want to see the data and see how people are entering things in, but also recognize this and said everybody needs to start developing coordinated entry. And it really is what it sounds like, coordinating the way people are getting in and connecting to services. So I'm going to describe what that's starting to look like. So we've gone from this, right, where there's like this precious resource and everyone is furiously trying to figure out how to get in there and nobody's really clear how to get to the thing you need, right? We're moving to a system much more like this. People come in through a few points, they get sorted, they get assessed, and they get connected with a warm connection to the things that they need. So the way our system is set up right now is really particularly around shelter, sort of a recipe for failure. So, as I said, we have about 1,000 people that are unsheltered on any given night and about 500 shelter beds. So there has to be some way to, how do you figure out who goes into those beds? So right now, actually we're transitioning away from this, but the way it's been set up is, say this person is 85, they have congestive heart failure, they're living on a park bench, they've been homeless for 25 years. You have this other guy who's 18, he just got kicked out of the house, he has a car, he has a job, he's just kind of floating, right? So this guy could actually get a shelter bed before the green person, the way our system has been set up, which doesn't make sense because this guy is really at risk of dying on the street. And when I talk about sort of, for me personally, why I'm so excited about it, we're really moving towards a system that is going to prioritize the most vulnerable people for getting the precious resource. We don't have enough resource in the system of care. This is not unusual. All the Bay Area counties are facing this. There's many more people that have a need than we have resource. So how do we ethically distribute that resource? So what I'm going to describe, some of this is in place and I'll tell you what's existing and some of it is coming. So we're getting a preview of what's on its way. So what we're moving from is that like hot mess, right, to 3 points of entry. So anybody can refer, so it could be a community member, service providers, law enforcement, healthcare providers. They have somebody in need. What do? There are now just 3 points of entry instead of that like morass, right? So people can call 211, and this is 24 hours a day, 7 days a week. You can actually talk to a live person. You may not get exactly what you need in that moment, but you're actually you're talking to a real person, you're not leaving a voicemail. Care centers, which are brick and mortar centers that people can walk into, and CORE, which is the outreach teams that are going out into encampments and out looking for folks that are pretty disconnected. If interim housing is available or appropriate, they're getting connected through those sites, eventually with the goal of getting folks into permanent housing. So if you've read the news at all, you know that we are in a massive housing crisis. So this part, there's a couple bottlenecks. This is a big bottleneck. We don't have anywhere near the kind of units that we need or housing subsidies, but we're working to get folks through, and this again is where that prioritization really comes in. So I'm going to go through this fairly quickly because I'll leave you guys with these slides. But for 211, this is good for folks that are literally homeless, but also those that are at risk. And this is a really good place for people that are at risk. When you see the person that's, telling you, I'm about to lose my housing, I don't know what to do, this is where they need to start. So they'll do prevention and diversion screening, but they will also connect them if they need to care centers, which are the brick and mortar centers where they can walk in. And also we'll provide lots of referrals for them. So they'll assess not just their specific housing, but also housing needs, but also sort of what are their other needs that kind of led to this. So care centers, there's 3 care centers right now. You will notice, so there's one in West County, and the location right now is a little, there's a site that's on Market Street, which is where it's temporarily going to be, but we're not publicizing that date, address, because we don't want confusion. But so folks can call 211, if you run into somebody and they're in West County, you say call 211, they'll get them that information. Trinity Center, and then Anchor Behavioral Health runs this site next to the Concord shelter. So you will notice, bonus points for anybody that notices what's missing.
East County.
East County, exactly. So we are painfully aware of that gap in our system and actually working very hard to identify a location. We have the funding set aside, we're looking for a location for a care center. And so this is for folks that are literally homeless, where they can walk in and sort of get basic needs met, showers, food, laundry, but also really start to connect in with service providers, do screenings around housing, all of those pieces that they might need. So for some folks that are homeless, once they have a housing assessment, they might be eligible for what's called housing navigation, where basically there's somebody that will walk them through the process of how do you get all your paperwork to apply for housing? How do you fill out an application? How do you talk to a landlord? What's appropriate to wear? They'll actually take them to meet with landlords. So again, this is something that's prioritized only for folks that are sort of hit a certain threshold of vulnerability, but that's new in our system, which is exciting. And then a warming center, which I'll talk about in a second. Any questions about care centers? So these have traditionally been called multi-service centers, and we've just expanded a little bit about what they're doing and sort of branding it as part of this whole system. But they're, if you've heard about multi-service centers, it's pretty much the same thing. So this part I'm excited about. So this is something new that we've added. So as I said, there's not enough shelter beds, and there are people that are really vulnerable. So getting a new shelter takes an act of Congress and huge amounts of funding that are nearly impossible to come up with and sustain. But what we're piloting is something called a warming center. And the best way to describe what makes this different from a shelter is this is chairs, not beds, right? So this is like a warm, safe, dry place for people to be overnight. There's not beds because that gets into all sorts of zoning and whatever, but there's comfortable chairs, there's showers, there's food, there's staff there to help start to get people connected. Right now, the way that people are getting connected to this is through our core outreach teams. So they're literally out in the field and identifying people ooh, you look like you need to come in tonight. And they'll actually take them to the care center and get them connected. So right now it's just Monday through Saturday, and so a lot of the limited hours just has to do with funding. So we're piloting this Monday through Saturday. So basically those, the Concord Care Center is open 8 to 5, they close down at 5. Everybody out, staff does what they need to do, they reopen at 7 as the warming center, go overnight, 7 in the morning, they'll close at 7 in the morning, everybody out, and then they'll reopen for business. So, yes, question?
Is that where Anchor used to be?
Yeah, so they're running this site.
Mm-hmm.
Exactly. Question? No?
No, I just
Okay.
worked with Anchor.
Okay, excellent. So we're also trying something called a Care Capable Center. So if I think about the care centers as the mothership, I think about this as the satellite, right? So these are, right now it's an agency, Monument Crisis Center. So they're not explicitly a homeless service provider, but they do see lots of homeless folks. So they have a little extra funding to sort of identify those folks, do a housing assessment, and also transport them or give them bus vouchers, transit vouchers to get to a care center to get the whole full array of services. So they have sort of limited drop-in hours. They do actually do appointments in the afternoons, but they're sort of publicizing you can just walk in off the street on these times. They also have they're a really good spot for families and seniors that are kind of trying to figure out how to start this process. Some of the other sites tend to have a lot of chronically homeless single adults, and for families with kids, that sometimes can be a little intimidating, so this would be a good first place to start. So housing navigation, as I said, folks that can help with filling out forms, gathering your paperwork, meeting landlords, and doing some transportation actually to some of those appointments. And then the Housing Security Fund. So I mentioned this at the beginning, and this is something new that we are piloting in the community. So right now we're at the place where we're building the fund. So the goal is to have $50,000 in this fund, and the Richmond Community Foundation is housing the fund. And we're working on sort of all the policies and procedures around disbursement and all that. We're not at the point where we're dispersing money yet. But it's really designed to sort of be an incentive for landlords that are maybe on the fence about renting to somebody who's formerly homeless, or helping folks who maybe they have their housing voucher but they don't have an income. So great, I have a housing voucher, but I can't afford 5 credit checks and 5 rental applications. That could be $200 depending on how much it is, how much each one is. So this is something that we're really at this point building the fund. So when people are kind of looking for something to do, this is kind of an easy way to do that. So you can actually donate online. And I also have I have information, I thought I put it on there, but I did not, about you can write checks directly to Richmond Community Foundation too.
Is that Stacy Street that you're working with?
Yes, exactly. Yes. She's been great. She gives us our little updates about how many people have donated. And so I think right now we have about $17,000. So we're chugging. We're chugging along trying to get there. So just a quick snapshot of what's new and sort of how the system is different from the way it used to be. So we now really, one of the biggest take-home is we really have 3 points of entry. So call, care, and core. So you call, you walk into the care center, or you have the core outreach team. I didn't mention, so folks connect to the core outreach team right now through 211, and they will talk to dispatch and figure out, it's not crisis response, it's really they're designed to go and be building relationships with people. The way I describe it is, say I'm out in the field and Juliana's on the core team, and I have been really resistant to coming in for services. I don't want anything, I don't need anything, I'm good. And now I have a cut on my leg that's starting to get infected, and I'm really not starting to feel good. And finally, she comes back week after week. The third week she comes back, I'm like, actually, can you take a look at this? They have healthcare for the homeless that goes out with them. It's really about building relationships and trust so that when somebody's finally, if and when they're ready to engage in services, there's a relationship built up. So other changes in the system, so assignment of resources is based on vulnerability instead of first come, first served for a lot of those pieces. Warming center's new, housing navigation. So we've had this kind of housing navigation resource, like once you got into a county shelter, the skies opened up and you got all this resource. But that's like a huge bottleneck in our system that doesn't work. So we've really worked to add this resource out at the care centers. We're also, this is a big one, and this is, Juliana's on the weeds on this. So working on standard policies and protocols across providers. So, all those pieces that I mentioned, most of them are done by different providers. This is not like the county that's doing all this. So, but all these agencies kind of have different cultures and different ways that they work. So we're trying to set standards for our coordinated entry system and have the experience be, it doesn't matter which care center you walk into, you're having the same experience. And you're getting access to the same resources regardless of what point of entry you hit. And then coordinated exit from homelessness. So this we've been actually piloting for about a year. So there's something called the VI SPDAT, which is our vulnerability index. It's basically an assessment tool that gives a number score for how vulnerable somebody is. And so when we have permanent supportive housing open, we actually use that list. We go from the most vulnerable down and look at the highest scores and do case conferencing one by one, starting with the most vulnerable and assigning the resources that way. Because it again used to be like, who had the most, savvy caseworker, or who got there first, and it's not a great way to prioritize when you have limited resource. So future growth, so these core teams, these outreach teams are actually, we've got new ones coming on. So Martinez and Pleasant Hill are paying for their own team to be in those 2 jurisdictions, which is exciting. Concord and Walnut Creek are almost ready to do that. We have teams that are also through Public Works that are in the waterways. So really trying to figure out how do we get teams out to connect folks in. Working on a care center in East County. Ideally, all of the care centers will function as warming centers at some point. We're just piloting this with Concord, and funding is sort of an issue for this too, around overnight staffing. And eventually, right, so most of these services operate Monday through Saturday or Monday through Friday. You're still homeless on Sunday, you're still homeless on Saturday, but this is really a resource issue. So this is like our big vision for the future. This is just a little bit about the implementation system. We're hoping to centralize through 211. So people call in, there's a screening tool to sort of assess how vulnerable they are. Right now, every shelter kind of does their own thing still. You have to still call around for that piece, so we're hoping to centralize that sometime in the fall. So just a quick piece about who are the players, right? There's a million providers. So one big group of players is the Council on Homelessness. So this is an advisory board to the Board of Supervisors, but they're actually also advisory board to HUD. So HUD requires that every continuum of care have either what's called an executive board. We call ours the Council on Homelessness. So they really help set policy. They're doing some monitoring about how things are working in the continuum of care. So these are the monthly meetings. They're pretty technical, but anybody's welcome to come to these. And then there are quarterly meetings that are continuum of care meetings. So that's we just had one that was a panel discussion about homelessness, about affordable housing. But this is just a little bit about the council, and that's their meetings are monthly. But then in terms of service providers, right, there's this laundry list. And these are all sorts of different kinds of providers. You'll see white ponies up there. there's lots of providers, and there are even some that aren't on here that not all of these agencies are funded by HUD or participate in HMIS. And sometimes folks are confused about like, well, what is it like? How do you get into the COC? It's kind of this like jellyfish term. It's pretty loose. There's about probably 8 of these are funded by HUD to do, but not solely, right? But they have projects that are funded by HUD, but a lot of these don't. So we kind of consider them all part of the continuum of care. And they don't all contribute information into HMIS. So how to help? Questions about the providers or anything related to this?
Well, the HMIS, I mean, do you think that White Pony Express should participate in that?
It's a great question. So I talked about this with Lavana because it actually came up. Your ED asked the same question. And, Lavana's response was really interesting. She said, if you think that there's something useful you can get out of that, because it will capture a bunch of data about the people that you're seeing. So I don't know if you're sort of already tracking sort of who you're seeing and what needs you're meeting and how well are you meeting your targets about what you're actually trying to accomplish. It's helpful for the whole system. For me, the more providers that contribute data, the more useful, because it helps us really paint a full picture of what is happening in the county. There are a number of providers that, like Bay Area Rescue Mission, for example, they don't participate in HMIS. And we know that there are a good handful of people that have not touched other parts of the system of care, so we don't actually know about them. We have this by name list of veterans. There are likely veterans at Bay Area Rescue Mission that we actually don't know about. So I think in that way it can be really useful. There is this administrative piece where you're then sort of bound by, rules about how you enter data and how often you do it. And so I think there are costs and benefits to that. And that's definitely something we can talk more about and pull Lavana in. But one thing that would be benefit for White Ponies, you have then a system that helps you really track what you're doing and how well you're doing it. So, yeah, it's a good question. So again, the Housing Security Fund. Oh yeah, good. So I thought I included that information. So this is about how you donate if you want to do it just for write a check. And another thing that we're always looking for are landlords that are willing to rent to folks that are homeless or have formerly homeless. So we have not, one of the pieces that we're missing in our system of care is something called landlord engagement, right? So we have housing navigators that are helping people kind of like figure out how you get in, but what we actually don't have are people whose whole job it is just to like go out and recruit landlords and sort of sell them on why would be a great thing to do. And I think right now it's really tricky because you can make a killing on the market. Like, why are you going to possibly take a risk on somebody who's formerly homeless, that maybe has behavioral health issues, whatever? I'm curious to see if the economy shifts. The programs that we run actually have very high success rates. So people that are in permanent supportive housing have a 98% retention rate in a year, and it's in the 80s in 3 years out, which is actually really good for just run-of-the-mill renters. It's because they have supportive services attached, right? So you're like, I always talk about it like, it's a total crapshoot if you just rent to Joe Schmo off the street. If you actually rent to one of our clients, you know that they are connected with somebody who is like monitoring them and that is going to intervene if something starts to go south. So if you know anybody or you yourself have properties, this is something that we're always looking for, our landlords who might be willing to rent. And then this piece about joining HMIS, so I forgot to add more there. But that was the very, very fast, that was a huge amount of information. So you may feel like this.